The condition is permanent. Yeah.
No condition.
The condition is permanent. Yeah.
No condition.
The condition is permanent. Yeah.
No condition.
The condition is permanent. Yeah.
Like we are living, my bedroom is full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. 'Cause no condition.
The condition is permanent. Yeah.
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 This is J-Vice Music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah. No condition is permanent. You never know if someday you will find yourself in that same situation. In this life, you see today, tomorrow is not promised. In a twinkle of an eye, your story might change. Be you black or white, no matter your personality. Be you rich or poor, your story might change.
For news, views, and entertainment, stay tuned to Society for Radio Democracy. 98.1, simply the best.
Good evening and welcome to the program Bodi Talk. We come to you every Thursday from 5 to 6. Inside the program Bodi Talk, we talk about different sick them, waiting the cause them, treatment, signs and symptoms, and self-prevention. We always get experts them at the studio for talk about different sick them. And inside this edition, we studio guest we Dr. Imnabo Harrison Senior, Register Obstetric and Gynecologist Department at the University of Salon Teaching Hospital Complex. They talk about preventing maternal death, the role of antenatal care, and safe delivery practices. And me will bring you this edition of the program Bodi Talk. Musa Kamara Naminim. Members see they listen, yourself will listen and watch we live na Facebook. You go get chance for take part na the program by way you go text on the number 077-981-981. Later inside the program, you go call and make your contribution. Ask questions about preventing maternal death, the role of antenatal care and safe delivery practices. As we get experts na the studio, we go respond to all your concerns and comment them. For Sekadat, I want to welcome my studio guest, Dr. Imnabo Harrison. Good evening and welcome to the program Bodi Talk.
Good evening. Thank you for introducing me.
I think this is not your first time for come
Yes.
Read Democracy.
Absolutely. This is my first time for come here.
Okay.
Yeah, we don't come before. We had a ethics discussion, I think. But I know the topic I couldn't remember, but I know we had.
It's been a while.
It's been a while.
You
A
don't,
long time. Yes, please.
Yes. Today we talk about maternal deaths and the role of antenatal care, care and safe delivery practices. Now we topic for today, but as always, people when they follow Bodi Talk know say we get quiz. We say we ask as to what we discuss at the last edition of Bodi Talk and waiting at some of the things them with the doctor will be get last week talk. We'll open the phone line after this break. We say you go call and answer the questions them we will ask as per the last program waiting we talk. We'll look for this break. We'll open the phone line.
condition.
The condition is permanent. Yeah.
No condition.
The condition is permanent. Yeah.
No condition.
The condition is permanent. Yeah.
No condition.
The condition is permanent. Yeah.
Like we are living my bedroom. It's full of so much surprises. You may be up and feel no one like you.
Good evening and welcome again to the program Well Body Talk. We come to you from 98.1 FM. No time to waste. We start the quiz and you will answer anyone from the questions. Then you get 50,000 leons to pop. And this is not courtesy of the University of Salon Teaching Hospital Complex for ensure we encourage listeners for know some of the things we would discuss inside the program, because this one now one way would raise awareness about health issues and one make people pay ultimate attention to them. And number one on the listener, that's name 4 type of hormonal family planning. And name four types of hormonal family planning. That's now we number one question inside the program, and we go answer them. Then the second one, they say waiting na the met criteria them way person for take family planning, and the 3 na the health what na the health professional for last week program Well Body Talk. We'll get a caller on the line. You name and we say the call from.
Hello, good evening.
Yes, good evening.
How are you, sir?
I do fine.
You are a call from Christian Constantine.
Yes, if you hear your radio, please you go shift a little bit.
Sorry. Hello?
Yeah, they get you now.
Yeah, the first question.
Yes.
You say, what are the names of owner?
Yes, now 4 types of hormonal family planning.
Yeah. The first one is pills. Pills.
Yes.
Pills. Well, we also have injectables, depot injection.
Go ahead.
And the third one will get implant. The one commonly called Captiva or General.
Okay.
And the last one will get the barrier metal condom and the barrier metals also.
You're quite correct. You talk about pills, infective rules, you get implants and contraceptives or condom. These are the now some of the 4 types of hormonal family planning. You missed that one out. Condom, no, did he?
Condom?
Yes, it's about types of hormonal family planning.
Oh.
Not of family planning in general. And the third question one will be able to ask now, what's not been the topic for last week?
The topic might be hello?
Yeah, I would get you.
The topic was family planning, facts, needs, benefits, and good health for
Yes. We'll give you this one. The topic for last week now, family planning, myths, facts, and benefits for good health. Congratulations. We will send you to pop 50,000 leons after the program.
Thank you very much. Thank you.
Thank you very much for always listening to Well Body Talk, and they take note of waiting the doctors, then they discuss inside the program. We don't get we first winner. We still ask waiting at the number is 077981981. Call and answer any one of the questions them and win 50,000 new leons to Popo will send immediately after the program. This one, name 4 types of hormonal family planning. Name 4 types of hormonal family planning. and the one say waiting at the met criteria them we pausing for do for take family planning. Waiting at the met criteria them we pausing for do for take family planning. 7798191 call and make your contribution inside the program. The program now Well Body Talk, where they come to you from the Society for Radio Democracy 98.1 FM. We don't get one winner. We still await 0779819181. But as we wait for calls them inside the program Well Body Talk, we come to we studio guest. We don't introduce now the studio earlier, and we topic for today now preventing maternal death, the role of antenatal care and safe delivery practices. We studio guest now Dr. Imnabo Harrison, and in come up from the University of Salone Teaching Hospital Complex, in come up from the obstetric and gynecology department. Good evening again and welcome to the program Well Body Talk.
Good evening, presenter.
We always ask we experts then at the studio for throw light on the departments that we then come on and the role whether department they play in the well body system or the well body sector.
Okay, so thank you very much. You pardon my Creole English.
You go balance the two so that so you go excuse we get a call quick, okay, please, and make we answer this one. You name who say the call from Well Body Talk. Hello? Yeah, I get you. Hello? Yeah, I get you.
Hello?
Yeah, I get you.
Number one.
Yes.
You get the pill.
Uh-huh.
You get it. You call the captain bag.
Okay.
You get the injection. You get the coil.
Okay. If person no answer, we go give them to you because if person no answer, we will give them to you as the program they go on. Just stay tuned to
Okay.
Democracy Radio.
Yeah.
Okay. 7798191. Now the number for call and answer. Two go on partially. If possible answer again, we will give this last caller the prize because a very very close to the answers them we get snare on the full type of hormonal family planning. The program now Well Body Talk. Doc, before we get for the call there at the program, you been the talk. Yes.
So the place where I come up from, or the institution where I come up from, now be the Department of Obstetrics and Gynecology. Obstetrics and Gynecology, now we they deal with this belle woman. Beyond belle woman, now they also deal with woman that we try for get belle, woman then we get problems like anything woman problem. Now we lead go into them for make sure say we try for take care of these women. We beyond because of this is a people institution, you know, say we not only like say we they take care of people, they train us to take care of people. We also they train, they do research, we they train students, we they pan in with the university teaching hospital, they also teach students on this well body for the woman, you know, kind of business. So that department, so some of us say they work at the government hospitals, they give our expertise, our knowledge in caring for patients, and at the same time, would they bring the best possible evidence-based practices to bear in line with current international standards to make sure say the best care is always available to the common woman that needs it. Our services cut across a lot of disciplines from contraceptive care, family planning, cancers, gynecological oncology, even fetal medicine, belle woman, which is the obstetrics itself, and quite a lot of other things which we do for women. So that's basically, in a summary, the kind of place we come from. And like I was saying earlier, as our university did so, that department for university did so, we were inside the department, now we still work inside the healthcare system as most specialist doctors and residents and some of us are consultants. We try to make sure say we impact these things we don't they learn from the classroom, from all the seminars, all the trainings we've had. We put into these women their practice to make sure say we give them the best possible care, the best care in the world.
Okay, and that's not the department where you come out. How it like in terms of delivery? Safe delivery, na salon.
So it's safe delivery for salon. Safe delivery for salon. It don't come a long way. And I know say there was a time where we say they will say salon get one of the poorest outcome, maternal mortality outcome, and even perinatal outcomes in the world. But since government had done, they take this issue seriously, together with foreign partners and local partners, we don't come a long way into reducing this maternal mortality. Safe delivery by itself now basically the things then we will get for do. Make a woman we can born in Peking. He born and safu, healthy mother, healthy baby, then go out safu, they don't get no problem. Now be basically what we go do. So safe delivery, only cut out just can't born in Peking. Before the woman they come at the hospital for day clean. Before they come at the hospital for don't prepare say in case this woman need operation, which is what they call operation, cesarean section. You need to born for himself if already. Blood services then day, midwives then day on ground. People then day on ground. We say make sure say as this woman enter from entry to her exit, she will get a respectful care, comprehensive obstetric care. Where we say nothing will happen to she or the baby, and all that they will they covered for till she come out. Now this conglomerate of services so they give woman at the point of childbirth, now we don't term as what safe delivery practices.
Let's look at what we do for prevent maternal death.
So say maternal death, as WHO go define them, now the death of a woman while pregnant, or within 42 days of intermittent of pregnancy, and that very long story. But essentially, once woman will get belly, we lost them within 42 days. Now maternal mortality. Now, how we take avoid maternal mortality? Be waiting. Don't be waiting with it like say, now we be all. Now a journey of everyone. So the woman we get the belly, it they involved. The woman. So I try to put some things in place. So when I go discuss, I'm going to understand them well. The woman we get the belly if a day involved. The man we get that belly for day involved. The family of those two people for day involved. The community for day involved. Then who will be the healthcare workers with day involved. Government and other organizations for also day involved. Now why they talk this now? Because of the woman, for make woman no die, the journey starts from home. So preventing maternal mortality will not go there ever complete. Will not involve the person will get the belly. So the idea that we say, as you feel say you don't get belly or you don't come of age, say you go to get belly. If you not say your journey to the hospital, no for they hampered by anything as an individual yourself. As you get the belly or the picking now underage picking, you get the belly, the caregiver for carry the person to the hospital because this care now for both women and adolescents because say of the environment we find ourselves in. So we encourage say for you to avoid maternal mortality, you as a belly woman, you must first of all get up from your house and seek health care. When you don't go seek this health care now, leave that rest to us. We now we go do we say we go make sure say we see you for the PHU. If not PHU you go, they go stratify your risk, log them in, say this woman a high risk belly, na low risk belly. This one for go to big hospital, secondary care, tertiary care center. This one go need this one go need this. And say as woman they come for that belly, as they can't enter the to pay they can't see the clinic. No like say they can't wait for just can't see the people they waiting in the hospital. If they can, as they come, they go assess you. Say you want for joint antenatal care. This antenatal care now, Nigeria most of the time, people they say as for also go carry the woman for go see doctor in the hospital. Not so most people they see them. But I won't let people when they hear this show today, make them know say, then they know to so. Before some of us we do what they talk now because before some of us do even this belly woman business with specialized spanner. Some of us don't do medicine before, they don't do medicine before they come. So what they tell us we say, when woman come, what would they watch? When they watch you with just in a belle woman. No, as you come for a clinic, as they register you, will they talk with you? Midwives, nurses, doctors, they talk with you. Oh, you get sickle cell, will they put inside that log for manage the sickle cell? You need to eat well, you dey malnourished, will they put inside that log book for take care of all of those things? You know, you get heart condition, hypertension, diabetes, you get any problem wey you get, those they go ask you question until they reach am, so that as they start that antenatal clinic, so all that problem will go carry am.
How old the belle go dey before somebody join antenatal care?
As soon as you miss your period, if you join. Now why this one? Na very important question, because most people go say make dem wait till 3 months before dem join belle. No, even the baby sef wey dey inside that belle, you no know whether you no dey eat well, you no dey eat well when e dey begin dey form. So even now, people dey even talk say before you even get the belle, if you begin dey can hospital. But how for do? Here and now, we dey say if you don get belle, can hospital. But ideally, before you dey even come, if you come do them check for if you get hypertension, it go affect the belle. If you get diabetes, it go affect the belle. If you dey chop well, it go affect the belle. You go affect the pikin. If you even get domestic violence, you go affect the pikin inside. But people no know say it go affect you and the outcome of your pregnancy. So they encourage the woman, as soon as you get the belle, if you come. What if the belle now no come for the right place? As you get belle, get to the call ectopic pregnancy. The belle dey for other wrong side. They can't bleed in both parts. Say, this pikin just bleed, he die. That's the reason why we say as you come, as you miss the pregnancy, you come. They begin they do the clinic for you. They begin do early scans for you. They begin give you supplementation. They begin look at any problem where you get. Because as you don't, that time you don't get that belle, now opportunity for doctors they for see you. Will they move you from obstetrics to the physicians if necessarily? Will they connect you people for do reproductive health care in case you get anything like cancer? Will they watch them? If you get any problem with your liver, your kidney, anything, physicians will see you. So the network of ANC not just be to say now we they see you alone. Will they network you with all services where you need to make sure say you yourself your health they better, because a healthy mother then because a healthy baby. So we the ANC now like a one-stop shop. Now like if you buy this mall, wait as the council will get you so all thing about you for which you to watch out, so that way during the pregnancy we'll be able to keep you alive. And if I thought the pregnancy no go able no go continue the pregnancy, we'll also tell you. You understand me?
What are the health conditions them way risky for somebody who get belle?
Risky ones like okay, so if we say let's put pregnancy into risk, all pregnancy get risk, but some we say na low risk, some na high risk. So the one we will call high risk, and then one then we be say maybe you get multiple like twin and above, twin triplets na high risk. Some other high risk na be say when you too small when you get the belle, you know, adolescent age pregnancy, that na high risk pregnancy. When you say you don't do operation before, they don't do operation for you before, na high risk pregnancy. When you be say maybe you get pressure, you get diabetes, you know, na high risk pregnancy. Maybe say before say if you don't even get you don't get belle before, the belle no come up fine, you either you see for that belle issues come up, you get issue for that belle, we dey classify you as high risk pregnancy so that we will make sure say we watch you closely and keenly. Now that na even the regular one we dey talk about. Some people dey we say they get problems with their kidney, their liver, you know, plenty other things dem dey when I would consider as high risk pregnancy. The ones dem dey we say they get problem with like they go able bleed, they get sickle cell, they able get what they call pulmonary embolism, like clot. You just they say you get heart attack by belle. On then the people who get them potential, then now they say, oh, these people are high risk. Oh, they need even more specialized care and frequent ANC. So we will monitor them closely and keenly for good outcomes.
The program now, Well Body Talk, with the Country from 98.1 FM. We listen to Dr. Imnabo Harrison, Senior Register Obstetric and Gynecologist Department and University of Southern Teaching Hospital Complex. Today we will talk about preventing maternal death, the role of antenatal care, and safe delivery practices. Well, we don't get calls, them we pick calls, and we also get its kind chroma from Liberia. I say oral contraceptives, pills, injectable contraceptive implants, and hormonal intrauterine device. That's now from Liberia on the questions where we be asked earlier. Congratulations you to get them, but we already be done get 076 when a 71 number start with been done already call 3 of them here. We've been decided for say okay due to the effort we the GAM. Anyway, thank you from Liberia and our Facebook page. You get them correct also as per our answer then I have. The program Well Body Talk they continue the country from 98.1 FM. Now, Dr. Imnabo, let we look at the role of antenatal care for reduce maternal death.
So now the thing we dey talk before still, but we go still continue for that.
Yep.
You know.
So
you
go in detail with them.
Yeah. So if you see a woman, if they come for antenatal care, if they come for antenatal care, we go able to detect when something they go wrong with you. As you come for antenatal care, we dey check your blood pressure, we dey check your sugar level, we dey screen for HIV, hepatitis B, hepatitis C, syphilis. You know, when you don't they do them thing they, as they come, we dey check for nutritional status. If they eat well, you need they eat well. We dey ask for domestic violence possibilities. You know, we look for social support systems for you. And when we do all of that thing, so as you dey come the clinic, if at any point in time we dey come clinic, you develop any, then detect anything, because the only thing we do so now for early detection that we dey on. If we detect anything, we dey say this one na issue, we dey flag am up and we move into the hospital system to make sure say we get appropriate care to correct that problem. And yeah, so that way now, if every time we as they come clinic, we dey see you fast, anything come up on time, we see am, we dey able grab am on time, and if we take care of am early enough, we dey able get good outcome.
What are the risks if person join clinic after 5 months or 4 months?
Now, if you join clinic after 5 months or 4 months, a lot would have been lost. Now, wetin we don lost na be say, one, if you remember say when person get belle, or for no say when person don get belle, na that early stage the belle, you know, e dey form. By then 3 months, pikin don form finish. So when you pikin, you can't get belle now, you pikin, you know they in a good state, healthy state, the pikin, it affect the pikin. You know, half of the time, like if you know they eat well, that pikin self, you know they develop well, you know go grow fine. For example, then if at all, say for example, you get diabetes, you know come on time, we foresee you know register early, we dey manage the diabetes before you get that belle self. The pikin they get abnormalities, can get some kind funny, they say na devil. You know, then come to think about it. The another thing I be say, what if now you get the belle no sit down for the right place. You don't know where the belle sit down. Then by then 6 to 8 weeks, this is now already 2 months, so the belle bleeding burst by the belle. That can kill you. You know, so you know the pikin say where you want for bring to the you want for bring, but all man want for bring good pikin. Where they smart, intelligent, we go able use all in functions well. So you as a person, belle woman, you want get belle, you for can early. So at that time when the pikin they form, that early stage when the pikin they form, we call them embryogenesis. The pikin will get all the necessary folates, iron stores, you know, for himself. Let you take grow, develop well. Then you too, wait that time when the pikin they mop up all the nutrients. Because from you the pikin they eat, they pull calcium from your bone. They pull folate from your liver, they pull iron from your system, you know. So that time, if that begin they put anything for me, you go come begin sick. You know you go come get iron deficiency, anemia. You know they feel fine, you know. Also, you know start early on time. The benefit of starting ANC now be say, of course we know say malaria dey boko here. Now this about now we dey in the malaria endemic area. You know come on time, malaria in self can just make you fall sick with severe malaria. You maybe even get a miscarriage because of severe malaria, you know, and that could be a problem. You know, go like that outcome. So the advice now be say, for every time you be say, as you get the belle, if you come early, they will begin for see you early and take you through the pregnancy.
Dr. Eminabo Harrison Senior, Register Obstetric and Gynecologist, Department, Ministry of University of Salon Teachers Complex. We topic today preventing maternal death, the role of antenatal care and safe delivery practices. The program now Well Body Talk and we bring and come to you. Musa Kamara Minim. We go for this break. We look at safe delivery practices and how it help for reduce maternal mortality.
no condition.
The condition is permanent. Yeah.
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 Like we are living my bedroom. It's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. But no condition,
The condition is permanent. Yeah.
'cause no condition,
The condition is permanent. Yeah.
'cause no
For
condition.
news, views, and entertainment, stay tuned to
Yes,
Society
indeed,
for
no
radio.
condition is permanent. The program now Well Body Talk. We dey look at preventing maternal deaths, the role of antenatal care and safe delivery practices. We don't look at we don't look at antenatal care. We don't look at safe delivery. Whose role safe delivery they play for prevent maternal death?
Okay, thank you very much. While we will introduce the topic, we say safe delivery now when the woman come for born. Now that safe delivery, it for person for come born, it entails certain things. Then, one, you need a qualified obstetrician and a midwife. We go deliver the woman. Also, then that way they deliver the woman. So now one are skilled workers, for they are available to the patient. The second thing I be say, the skilled workers forget the right environment for work. So for those skilled workers, the first thing I be say, they go able to deliver this woman safely and manage waiting will happen in case they get problem. Now I bring them to bear. If woman now, as a born in Pekin, he begin bleed, you go able manage them, now be safe delivery practice. If woman born, when he born now, he get a after birth fashion. He able pull her. If woman born, or he able born for himself, are able to do operation, safe operation, and that what they talk about. So the whole idea behind safe delivery be say, let this woman, he come inside this hospital, he get respectful maternal care for childbirth, then let all side clean, like because you know go begin touch the woman with your hand, so like make sure the place they clean, all the things for this woman they clean, the woman will get infection, then you go able kind of make sure say you get the medicine the way be say you forgive the woman to make sure say you no bleed boku or you no bleed at all after he gets he born in Pekin, he able pull him after birth fine, he give the Pekin newborn care, he prep them too, watch them cleanly till they don't stay there 12 hours depending on how they watch them before they go near the host. So how this thing they impact maternal mortality na be say you go see say some people then as the one born in Pekin, they need kind of hospital for professional care. They go to them TBA, then granny already na the street, na the area, the mommy queen them for born them. Mommy queen they don't know what thing I made. They clear book, use glove, use face mask, use face shield, and they they are available to them. So mommy they go do it the traditional way. We be say now as you try for born the woman, dirty go enter the woman in body. Not so? Because before you hand must get soil with blood. That blood can lead to what? Cross infection. You understand me? So that woman can begin getting, oh, don't say in womb don't infect. Problem. Now, secondly, maybe that mommy now, you as he born, bleeding burst by you. The mommy maybe not even know the techniques then where would they take the stop woman from bleeding. So if woman bleed till he bleed, he go die. So on the contrary, in our own style of doing work, as woman begin for bleed, we dey activate a lot of protocols. We get the Amstel protocol, we get the hemostasis protocol, we get protocols so we go just activate. We already we get the package and they there. So as it begin for bleed, we don't begin run. For me to say no bleed, we stop everything from bleeding.
Stopping everything from bleeding at one. But the issue of the bleeding and the replacement of that blood we don't lose, blood need for be available. How important that day?
So even part of the thing where we dey talk about now, say availability of blood service, that make it the for Can hospital for Can born. By the side of the hospital, we get a huge blood bank with donation systems available, you know, for you to get free access to blood. So even as we dey talk say you dey bleed, as we dey make sure say we give you medicine to stop, to make sure say the womb be whole, you know, for bleed. Already people don already arrange. Multiple people then do, they attend, a team, they attend to you. Some people don't go they get the blood. Some people they sort other things out. They will say, oh, if you need for go do a certain operation, the information they stop for bleed. We did those things. There's also day. So she say the advantage I be say you could decide a system that protects you and plans for you ahead of time. So some of the people that they will say, no, say, this woman, if the pikin been big reach a certain level, for prepare say, if you go likely bleed. But the mommy queen no go know, that village will no go know. You go say, all born are born. Not so. Then even at that time, that woman don't born that pikin at that village or that PHU or sorry, that village or that how to put that TBA in place. Before you begin, they run the camp. You say like now, it wasn't at PHU you born. The patient people go to say, when they get also person where they bleed though, ambulance go pick up. The delay go dey reduce. But you will say one born a TBA in place. Before she go begin taking, they go the nearest PHU. They begin now delay and everything about woman born one.
Now, how long woman they bleed for before?
So when you born the pikin, you know say that side way the afterbirth come out. Now raw one. Now that way the placenta they connect to the uterus for let the pikin also get in food. So when a woman you born naturally, as you don't born the pikin, the womb will go for contract or it will become small or it's strong. Then as it is strong, so it push out that placenta. And when we put out that placenta now, it close that place of the placenta be not attached to we get blood. You see now blood they give the pikin food. It go closer. That way the mommy no go bleed from that place now. But when we say, for example, now the placenta na half come out, the other half hang. You know that it go they bleed from that place. Or let's say the placenta all come out, but the womb, you know, we don't call uterotonic. So kind of message with oxytocin, you know, gometrine, what do they use for mission the uterus contract. If you know day with you at that point in time, the thing go open, and once it open, more blood bleeding go pour. And for belle woman we just born, in less than 2 minutes, the kind of blood they lost. Sometimes now 1 liter of blood they lost. So early action is very important. As if you get to detect say woman not they break action for day institute immediately. And sometimes they even advise say you for even institute action before what?
What about the one that way they born the PHUs them way them facilities here?
So now they talk say we get low risk pregnancy and high risk pregnancy. All pregnancy get risk. Our PHU they don't government has been assisting to train within the health workers. So even the PHUs get midwives, they get RONs, they get nurses, the way they're capable of managing labor for low risk patients. Now for those patients they get those AFAF medicine they will take care of them. Unfortunately the PHU, of course, you're not going to put blood bank everywhere. So PHU not going to do blood transfusion, PHU not going to do cesarean delivery, not also for like Caesar, how do they call them? C-section, how they take born pikin. So the PHU now for do immediate care. But our general advice now be say, as health workers, we get protocol of escalation, which is the referral system. This belle, the risk it pass your own level, send and go up. This belle, the risk it pass your own level, send and go up. Then if as they manage that woman, any risk show, it pass you, send and go up. That way, the highest level go receive the people that we need that high level of specialized care the most. So women go born a PHU. Most of them will get problem. They will give them the oxytocin after they deliver the baby. The all thing happen normally. But at least for PHU, you're already in the system. As anything won't happen, the ambulance know where to go and pick you from.
No. In this issue where they explain, they use many tools in delivery, and some people can go to hospital with condition.
Yes.
Maybe some picking the parents go don't get HIV.
Yes.
And or it gets some sick.
Yes.
Where the picking don't contract already. But if you use the scissors or any other thing for cut that placenta,
Yes.
what I can do not for use and for other picking so we no go get this sick.
So, Matt, tell you. So the thing is that we get. Now, tell me time will tell you about infection control and people getting infection. Now that's
Yes.
I try to address some a little, but I don't want to use complex terminologies there.
Yes.
So one of the things for safe delivery or safe delivery practices now infection control. How face masks, how hand gloves, how the issue of HIV and communicable diseases and sexually transmitted diseases, bloodborne diseases is a very contentious issue. Very a bit contentious. So even when, as a standard of care, we have a lot of what we call consumables, which are like easily one-use items. As you use them for that patient, you're done. It's in a bin. You get the idea? Then, if at paraventure we need to use certain material that has to be used, we have to have what they call the sterilization protocols. So everything we use, we get different levels of sterilization. The disinfection protocol, then we have the sterilization protocol, then we have the autoclave protocol, where we say different levels. We say we will kill all those organisms. If I talk, for example, iron scissors, that one no go dispose them, not also because it's still good, still reusable. But that one now, they go first wash them with soap and water, clean them, put that inside some sort of chlorine for a certain amount of time. Then they move into what? Inside the sterilizer, they put that inside, they get hot water, inside steam. You get the idea. So by the time that thing now is a standardized way of disinfecting items. However, like I told you, a lot of things then they use it now. We call them one-time use things. Like the glove now, one-time use. You understand me? Even the amniotic hook now, one-time use. So all of these things are put in place so that one time is basically as a user for this person, it's a disposer.
What about that when they dispose?
Now they talk, say those ones now,
yes.
those ones now you get what they call the way to take disinfectant. To make sure say nothing cross into anybody.
In the case of HIV, can that be disinfected?
Yes. As a matter of fact, the thing is that if not for saying would they use, if you look at some of the sanitizers, they go say 99.9%, not also virus, bacteria. But we don't take this as like that it is good enough. So you go tell you say, even if you clean your hand during the COVID, they say wash your hand with soap and water. It takes care of a lot of things, not so. So imagine say you wash with soap and water, then you call use chlorhexidine disinfectant, then you come put inside hot water with a ball with steam for 30 to 40 minutes. Nothing survives that environment, not even HIV. And aside that one, why would they like to push on this discussion? Like I know the comfortable time. You go find out say we make sure say somebody get HIV or any diseases. We don't want to make sure that they feel stigmatized.
No, it's about the newborn baby themselves for be safe.
Or for the babies of the mother.
Yes, the babies.
So,
when they born, when they cut the umbilical cord, let themselves not get this.
So the
sick.
mother of that, the baby of that mother.
No, it couldn't be the baby. Maybe somebody will be positive and negative. Both parents will be negative, but the pikin will contract.
That thing, I'm not going to tell you like I said, we have a compartmentalized way of managing patient. One midwife or two midwives on one patient, and every time when you finish into that patient, there's a protocol for hand washing, sanitization.
So that's not possible at all for let pikin take some infection at back.
From a mother with HIV to another baby that is is negative.
Yes.
No, it's very unlikely. Very unlikely. I've never seen it in my whole practice of about 15 years.
The program Bodi Talk, they can say from 98.1 FM, and you listen to Dr. Imnabo Harrison, Senior Registrar Obstetric and Gynecology Department at the University of Southern Teaching Hospital Complex. Today, we look at preventing maternal death, the role of antenatal care and safe delivery practices. 077981981. Call now and make your contribution inside the program. We'll get first caller on the line. You name it, we'll say the call from Bodi Talk.
Yes, good evening, sir. How are you, sir?
Yes, how are you?
Yeah, this is my principal call from Brooklyn. The question is about question I'm going to answer.
Oh, we don't answer. They don't answer, and we don't get the two winners then.
Okay.
I thank you very much. And we also the appeal to you who listen. You want for support well body talk, so we able spread knowledge about we health system and seek them with a winner society. You can come and support so that we'll get more prizes them for give out. But as it stand now only 100,000 we dey give out 50 million per a winner. We don't get the winners then. We will send then airtime to the company we they use 0779819181. Call and make a contribution inside the program. Well, Body Talk, we they come to you from the Society for Radio Democracy 98.1 FM 7798191. And my studio guest for today, Dr. Imnabo Harrison, Senior Registrar of Obstetric and Gynecology Department at the University of Southern Teaching Hospital Complex. May I bring you this edition of the program, Musa Kamara and Minim. We'll go for this break, we'll come. We join with studio guest again for look at some of the issues then. But quick one before we go for that break, we'll get a caller on the line. We can pick this one before we go for the break. You never said a call from Well Body Talk.
Yes, hello.
Yes, you never said a call from.
Yes, when I concern citizen, I've been just worried to that last question where they talk about the PK contacting.
Okay.
Yes. I think the thing that happen is that even the same way the woman get belly, if for example say a positive woman gets HIV, right from the time where it ends, and because they encourage women then when they get belly with positive, let them come for ANC. Because when they come for ANC, they get the treatment. And once they take the drugs them for HIV, that also the help for the beginning when they inside the belly. Very, very important. You know that one of the things services where the ANC for offer for provide drugs and testing in fact services for pregnant women when they come to the belly. So it's important for them the woman then for the camp ANC. Then after that, even the time where the woman is born, if they don't find out say this woman a pregnant woman will get HIV, as she is born, it knows them and don't also train them on or give the pikin medicine where the HIV program they provide to the pikin. You know, that's also the ethnic pikin. But as the doctor just say, everything starts from the antenatal clinic. If the woman they come to antenatal clinic, then the risk for the pikin is very high.
Thank you. Thank you for your contribution inside the program. Thank you very much. We appreciate them a lot. We'll get another caller. You never said a call from?
Yeah, my friend. Hello, Musa. I come from Manchester.
Who's friend?
Thank you very much.
Our friend from the other side.
Yeah, thank you very much. Yeah, no. Just regarding that, thanks very much for what you want to do there. Just ask a few questions. I know you really asked the doctor about how they will prevent teaching they not get sick during delivery.
Yes.
I just want to ask, what about this time for the doctor for answer? What about women that we get gonorrhea, that gonococcus bacteria? How it affects women when they born, newly, when they just born, not to me, when they just born. How the pikin, because the pikin is the way they count in head first, I go affect in eye, because I think say most times during delivery, women will get gonorrhea, when the pikin they come for that first time, they affect in eye. Some they not treat like even get blindness. Then I want. Then secondly, you mentioned about oxytocin and egometrin for GAM in terms of like if they get placenta retention or then get other thing when the placenta no one come, how much then you take control like normal delivery for letting not go GAM so that contraction not will happen so much for damage in uterus because membrane GAM for help woman in contraction. You see, something can even damage the uterus will not get well. Then another one. And then when woman get placenta previa, then I like put the placenta the day before the picking hit, how they can manage them. that another one they no more. Then how then they use this new app which the ministry don't take, how much the statistics they reflect, especially in terms of the provinces. Because I sit on and get access them, but the province is more. Now that area there, I don't know how much they reflect on that new app with the monitor the ministry don't put. Thank you very much. May God bless you now. Thank you, sir.
Thank you very much,
sir.
Usfred, a regular listener of Bodi Talk. Always they join this program from the UK. A lot of questions for you. Can you answer to them before Api calls them back?
Okay, so thank you for the questions. I think the first caller, when they talk about, they talk about how to prevent mother-to-child transmission of HIV and other transmissible disease, blood transmissible diseases in pregnancy. This is against the fact that what we talking about, say, now cross infection we they worry about inside the studio, not so?
Yes.
So, but if we get to address that topic, he's largely right, and if, because that one and the mama and the pikin, we in the born. Not that one way you talk, say, for another person pikin.
Yes.
So this one, if you want for me to say woman, he give a pikin HIV or hepatitis B, they would get what they do for them. They would call them a whole lecture on this what they call prevention of mother to child transmission of HIV. So now you come across where you say you go to give early detection for the mother, active, highly active retroviral disease treatment and combined treatments for the mother, and monitoring the mother's progress and sensitivity of the medicine. It's a lot of discussion, but the idea is that if we treat the mother well enough, even at the point they born the pikin, with the good amount of medication we don't give, once them pass them 8 weeks rather, you expect that transmission level will be very low. Then the other things we will do for inside that particular delivery itself, like early cord clamping and careful, almost nothing, no suctioning or gentle suctioning of the, basically just to make sure say nothing of the mother, mama and blood, it reach the pikin. Summarily, we no go come begin they aggressively they get what they call suction the pikin nose, suck a mouth. No, just gently clean, gently dab. Then even after that, the pikin too can get his own medicine when a syrup where they take to make sure say the pikin no get any problem like that. But that now for the pikin with the mama born. So? As against what we'll be discussing now, cross infection from a mother that has it, not to a baby to another woman's baby. The other caller, I talk about the effects of gonorrhea, on newborn. That one I also they call ophthalmia neonatorium. Like, if there's no way, just wait for the HIV, they talk about the HIV, where the pikin go pass through the mother's canal. Go engage, what do they call it? Go pick up some things from the mother, enter an eye, a nose, a mouth, an ear, And our job is to make sure that we look out for such things. So, for example, say your belly woman, he come to you in the later part of pregnancy, say, they get this vaginal discharge, which is more synonymous with gonorrhea, not so? Or gonococcal urethritis, say, are they wet? Are they feel pain? Why are they wet? Already instantaneously, if we treat, you get the idea. Now, however, even at the backdrop, where we say, if we don't know, there's what they call the tetracycline eye ointment, will be part of newborn care. We're supposed to prevent or be prophylaxis for ophthalmia neonatorium, either from staphylococcus, streptococcus, or gonorrhea, or even chlamydia at some point. So these are the things they put in place to avoid that pikin get eye problem. Then for the children, we say they get the mama they obviously sick, or previously the pikin don't get infection. Would they get to the go standardized care for patients like that? Maybe say as them born the pikin, based on say the mama gets streptococcus infection, evidence of streptococcus infection, would they able to send you pikin go early to the SCBU, which are the baby side, may then give you early treatment to prevent what they call neonatal sepsis. Understand me? Then for the oxytocin use, I think say in talk about how for use the medicine, burst the woman in womb.
Yes.
So oxytocin use get different times to use them. When woman get belly, it depend the belly. It try to say the belly hot and fine. We get where they use them. We get where we can use them after I don't born the pikin. The one where they cause uterine rupture the most and what is more common now when the belly inside the belly, then you know somebody for gear. that one will get a low dose protocol, a high dose protocol, depending on the gestational age. Of course, you don't go give that kind of medicine when woman get belle, you don't do operation for them before. Understand me?
Yeah.
So I feel say what we talk about, I be say as you don't born the pikin, we forgive and standardize those, which is what they call IM oxytocin 10 international units. You give them. That are part of what we call the active management of the touches of labor to help the woman make the womb contract. Rubber contraction, controlled contraction, and all of the controlled contraction and newborn care. Together with uterine regular uterine massage. Now, if for any reason the woman begins to bleed, at that point, now a different thing you go do. Even the oxytocin where you go give, now a different thing. Because that time now, you go to oxytocin as a means to what? Control bleeding and hemorrhage. So that point, I go begin 20 international units in 1 liter.
Osfred also asked about where the placenta day before.
Okay.
The picking, and also ask about the app where the ministry they use now for monitor some of these things. I think he can respond to the end of them. We could not get better.
Okay, so sorry. So the when the placenta day in front of that one means say the picking never born yet too. Not also. If the after birth for front, the picking never born yet. So sometimes the after birth for front, as because of say we do antenatal care, we can say every 36 weeks we for do birth preparedness. Now this is if I thought we miss, so because this is what we do now, multiple levels of catching. We call it multiple levels of catching. You day 13 weeks, you will do scan. You day 25 weeks or 26 weeks, we do scan. 28 to 30 weeks, we do scan. Not also.
Yeah.
So if at all our scan you miss or we miss, at 36 weeks, we'll be able to still do one scan, what they call the birth preparedness scan, where we will take see where the placenta day. Every woman is supposed to do that. You get the idea? So at all, and it's free. So if you do that scan, you get to say this after birth, you day for front to go say, Mama, we don't want to let anything happen to you. This pikin, you know, go come on and do. Love for go pull am with abdominal delivery or cesarean section, as the case might be. Not so. However, if by adventure you know kind of hospital at all, then bleeding burst by you can't meet us. You can't meet us. Say I dey bleed though. Then as the middle way you come, point of care scan go still dey done again. To say because he did at the hospital. As they enter the hospital, you go see scan. Say, let's check quick. What make this man they bleed? We say after birth for front, Mama. At that same point in time, if they bleed heavily, we go say waiting. Oh yeah, let's rush to the theater and get it out. Give you blood, remove that baby plus the placenta, and make sure you're fine. Unless otherwise everything they okay, na small blood come out, we say stay inside hospital until you born your pikin. Belly pikin match inside the belly. And then the ministry app. You know, say the thing about app, we even me too are still they new to them, but the IT people then go really good at that discussion on how user friendly it is. Because understand what I mean. So I mean I'm not an IT specialist, but I feel that the front end is a bit it's good enough for us to use, and when they track women there will be red flags. So most women, in fact, it's not even an app self. The app alone they lead to another what they call the dashboard, where they say the ministry surveillance system, where as them log your pregnancy from the PH you go show, then you go show as green. If pregnancy get any issue, then log and you go show as red. So they will know how many red pregnancies in the country, high risk pregnancies in the country at the moment in time. You know, so it is not just not like just an app. Now app will connect to an international network system that's monitored by a lot of people. So me, I don't be really, I don't do good in that thing. So I don't go able like talk. So because I don't understand the question, because I know we're a front end problem or back end problem, or now me the user problem, or now him no interpreter problem. So I don't know how to approach his question unless maybe he can ask it some other time.
I mean, you tried that one. Thank you very much.
All right, thank you.
And plenty thank you to listeners and viewers. You will call and win, you will not win, and you self will listen. We want to expand this quiz, so we get more people will go win prizes. So more people go ask questions them with regards the thing that we will discuss or discuss inside the program Well Body Talk. Now this edition of the program go live for today. Plenty thank you to our studio guest Dr. Eminabo Harrison Senior, Register Obstetric and Gynecology Department at the University of Salon Teaching Hospital Complex. Plenty thank you for joining me inside the program Well Body Talk. And plenty thank you to we partners them. We in the University of Salone Teaching Hospital Complex. We don't they support we for run this program for the past 2 years. I mean, within the support we doctors. Of course, well, body talk on past 10 years now already democracy or even 15 years. But recently we enter into agreement with Teaching Hospital Complex. We don't provide with experts them for can give knowledge to the public about things that will happen now the well body sector about the health. This edition of the program go left for today. Plenty thank you to my producer Carifa to Conte. We produce this edition of the program Well Body Talk. Plenty thank you to Joseph Songa for technical support. Mary Kamara Bangura. We make kuna see we live na Facebook. So today, Musa Kamade say have a wonderful day.